Okay, so when you're starting out your cash-based physical therapy practice, what's all the documentation that you're going to need? So here's a list of everything. This is actually inside the Business Essentials course. I just want to give you guys an idea of what documentation that you're going to need. So initially, you need to design a new patient packet. Okay, and this is going to have all your medical PT forms and the intake stuff about pain, injuries, past medical history, and stuff like that, in combination with the consent to treat and notice of privacy practices. So I like to make it a enjoying experience that is not crazy monotonous and a lot of stuff. So I kind of combined it with the patient experience and I created my own new patient paperwork. It makes it simple and easy. You could have it as a fillable PDF. You can have it as an online form that they log into a portal and fill out online. However you want to do it, you have to have some sort of new patient paperwork that they can sign all of these forms and the consent to treat and stuff like that. So you are going to have some sort of new patient packet of some sort, whether it's a fillable PDF, a printout version, or even an online form. Next, yes, you are going to have consent to treat. Highly recommend that you either use my template or you get a lawyer to make sure that it's written out properly. The same thing with the notice of privacy practices. So number 2 and number 3, make sure you get it legally correct and you have consent to treat and notice of privacy practices that are done and implemented. Okay. Fourth, you know, you need nowadays with social media and taking pictures and posting testimonials, we created a testimonial waiver form to handle all of this stuff, which, if someone signs this, it gives us approval to be able to shoot a video, take a picture, to share their testimonial for marketing purposes. So we have a testimonial waiver form. We have a Medicare form also. So again, going into the whole form of whether you're seeing Medicare patients or not, if you're seeing Medicare patients and you have a Medicare relationship, you're going to use a ABN. If you have no relationship with Medicare, you need to create your own form. So your next form that you're going to need or documentation is going to be a Medicare form. Communication waiver form, we do like to email and text patients. So we, have something written up that gives us approval to allow to text and communicate with patients via email, text, etc. So we have a communication waiver form. If you are cash-based and you're out of network, you have to have a No Surprise Act form. So we took the No Surprise Act and pretty much dumbed it down and made it into a form where at the end of every eval, we give them a good faith estimate. So you have to have a No Surprise Act form. We do a lot of dry needling here. So we also have a dry needling consent form. And then the next 4 of them are just typical PT eval, PT SOAP note, PT progress note, and a PT discharge template. So we have our evaluation template that all of our PTs use. We have our SOAP note. You guys know what a SOAP note is, your progress notes, and a discharge template note. So those are the 4 standard kind of PT documentation forms that you'll need. And again, everyone has their own thing. And your State Practice Act is going to give you the minimum documentation standards of what you minimally have to document. Like in Florida, we have to establish a plan of care. So we have to do a evaluation. And then we need to have some sort of plan of care established. And then we have to have a discharge note, but there's nothing really that says anything about doing progress notes or SOAP notes. So your State Practice Act will show you the minimum documentation standard that you need to do. But most people will definitely have some sort of eval and discharge template. And then the last form that I give you is my reimbursement form template, which you're going to need if you are going to provide reimbursement forms. And we do things that we do package in individual sessions, and we have templates for each one of them. Not all cash-based practices do reimbursement forms, but if you do, you have to modify that HCFA 1500 form. We created our own template that's kind of modeled off of that, but if someone submits this, it gives the insurance company everything that they need. So this is all the documentation that you're going to need to start your cash-based practice. You have your new patient packet, you have your consent to treat and your notice of privacy practices, you have your testimonial waiver form, your Medicare form, communication waiver form, No Surprise Act form, dry needling consent form, your 4 PT ones, your PT eval, your SOAP note, your progress note, and your discharge note, and your template for a reimbursement form. And that is all the documentation that you will need to start your cash-based physical therapy practice.